Okay, I am going to go ahead and get started as I know people are still trickling in, but we have an amazing presentation. So I definitely want to give our experts and our speakers here today all the time that they need to present. So welcome everyone. This is the first session of a two-part session that we are doing in collaboration with NACC, or the National Association of Community Health Centers, on workforce wellness. Oh, and give me 1 second. There we go. It wasn't advancing at first. So if you've been to any of our STAR Center trainings, you probably have seen these next few slides. I'm just going to do a few intro slides and then pass it over to our wonderful speakers. But we are the Association of Clinicians for the Underserved. So we will serve as the moderator for this first session, and then NACC will serve as the moderator for the second session that we are actually holding tomorrow at the same time as this one. But ACU, we were founded about a little bit over 25 years ago by National Health Service Corps alumni, still very much at the core of what we do, but we have a lot of different types of programming, really focused around workforce, but even beyond that, different clinical needs. But the program specifically today that brings us here is the STAR Center. So that's the Solutions Training and Assistance for Recruitment and Retention. So with this slide, what I like to point out is we are one of 22 national training and technical assistant partners. Actually, NACC is one of the other 22 as well. And we're funded under the Bureau of Primary Healthcare and also the Health Resources and Services Administration. So really what that means is everything we produce, the resources, the training, the technical assistance within the STAR Center program are all free for you. Our specific focus is on supporting health center recruitment and retention. That is our NTAP focus that we have. So please reach out to us if you ever have any questions or need any support. We do have our own site, which is www.chcworkforce.org, or you can contact us at info@chcworkforce.org. That does go to a real person, my colleague, Sydney Axelrod, and then she filters out the questions as appropriate to the rest of the team. And this is the wonderful STAR Center team. So we like to put this slide on here just so you all can know who we are. Specifically, I'm Michelle Fernandez Gabilondo. I'm going to be your moderator today. But as you can see here, we have the amazing STAR Center team. We also have Mariah Blake on the call today. And then, as I mentioned, Sydney Axelrod and Suzanne Spear is our VP of Workforce Development. Also with this slide, we always make sure to include it so that you have our direct emails as well if you need them. Okay, so very quick housekeeping, and I know all of us have been in this virtual world for so long, we probably already know this, but it's good to always just state it. But the session is being recorded, so the recording and the slides are going to go to all registrants. That will be sent out once we finish the webinar series. So like I said, we are having our second session tomorrow, and then Mariah will get everything together within usually a few days to maybe a week, and is able to send everything out. If you have any questions or you want to share any comments, any thoughts, please use the chat box. As our presenters are speaking, I will make sure to keep track of the chat and, jump in if any of the questions make sense to ask at that point, or we can also ask the questions at the end. If you are having technical difficulties, Mariah Blake is your go-to person. So feel free to just send her a message. If for some reason you can't hear something or something is off, she will be able to assist you. And then at the end, we have an evaluation, and we would definitely be most grateful if you could please fill out that evaluation. It is a requirement for us to do that as part of the funding that we receive, but also we just want to know how can we best support you and bring you the type of training and technical assistance that you need. Okay, so before I pass it over, our speakers are from Yakima Valley Community Health Center. We're so excited to have them here, and they're going to talk to you about what have they been doing in their health center to really focus in on staff well-being and wellness. But before that, I really just wanted to very quickly kind of kick off this series with us thinking very high level of what does this really mean? What does wellness mean? What does well-being mean? And we know that this is a struggle in health centers. We know that burnout is very prevalent, is very common. So when we talk about and when we present the idea of well-being, we want you all at health centers, or really any organization where you may work, to think about it from many different perspectives. Like, there really is not one magic solution to this or one right or wrong way to do this. But at the STAR Center, we specifically talk about pillars of wellness. So we talk about 4 of them, which you can see here on this slide: physical, emotional, financial, and communication. And really, all that's saying is to take into account for any of your staff that they're a whole person. There's a lot of things that they may need support in. So just again, keeping it very high level, when we look at that physical well-being, those are things of, like, setting offices so people have the space to be able to move around. We know movement can be really helpful. The emotional, that's where, do you have like an employee assistant program that you're providing to your staff? Do you have really great mental health benefits when it comes to your medical insurance? The financial, a lot of times that tends to be overlooked. And when we're talking about financial, those are things such as, bringing in a speaker that can talk to your staff about how to better manage their finances, ensuring that your staff are receiving a thriving wage. All of that really affects, again, the wellness and well-being of individuals. And then finally, when we look at communication, that's central to any of the work that we do, especially in healthcare. But when we look at the workforce, it's really important that people feel there's trust, that they're able to really go ahead and communicate multi-directionally, regardless of the position they're in. So as I said, this is really high level, but it's really just to set the stage to get you thinking, what are all of these different aspects that really affect the well-being of your workforce, and how can you then strategize to support them in all of these different areas? So with that said, it is my honor to go ahead and pass it over to Yakima Valley Community Health Center. They're going to do an amazing presentation about the work that they're doing at their health center. So please take it away, and thank you so much for being here. Oh, and Chrissy, I'm so sorry. It may just be me, but I am not hearing your audio. Is anybody else having trouble hearing Chrissy? I don't know if it's just me.
Yeah, I don't hear her either. I did hear you before though, Christy.
Yes. Chrissy, I may suggest try to turn off your audio and turn it back on to see if maybe. So yeah, just a few technical glitches, everyone. We know that.
Okay, can you hear me?
Yes,
Yes,
perfect. Perfect. Thank
lovely.
you.
All right.
All right.
Okay, I'll try again. Hi, thanks again, Michelle, for that wonderful introduction. Hi, my name is Christy Trotter. I'm the CEO at Yakima Valley Pharmacists Clinic. I've been with the organization over 30 years. I'm really excited to have Jessica and Andy talk about some of the things that we've done with space to support our clinical team. And as Michelle was saying earlier, it's not just one thing that you can do to impact well-being for your providers. There's multiple things, and that's the same for us. We have lots of different initiatives that we are currently doing and have done to try to improve the work environment for our providers. But today we are going to focus on our physical space that we've transformed to support our clinical team cohesion. Next slide, please. And this is just an overview of our mission, vision, and values. And this cohesive workspace really leans into our mission statement of eliminating barriers. It's not only eliminating barriers for our staff, but for our patients to receive the best holistic care that we can provide. Next slide. And we are across 2 states. We have over 49 unique locations. So all of our communities are very different, so it provides some additional challenges when you're in distinct communities, but it also provides some excitement in the workplace for sure. Next slide. We've served over 200,000 patients last year, so that's our highest ever. Almost 800,000 encounters, and a large portion of our patient population are children, so about 43%. Next slide. And, you know, like other community health centers, we have a significant portion of our population that is below the poverty level. For us, it's over half. So that also provides unique challenges in how we need to provide, you know, true holistic care for our patients. And with that, I will let Jessica and Andy talk about our space. Your audio, Andy.
No, I don't think we can hear you, Andy.
Oh.
And for everyone, we'll be back in a moment, just working out the technical difficulties.
No, that's weird that
No.
it changed. Jessica, we might make you go first.
Did you try turning off your audio completely and turning it back on the computer? And said, try the microphone key on your computer. Yeah. Okay. Well, I can take over until Andy. So Andy, if you keep trying your audio, and if it works, then you can just jump in and interrupt me. Does that work? Okay. So I think with our I'm from Yakima Medical Dental Clinic. So my name is Jessica Johnson. I'm the Senior Regional Director of Operations for 3 of our sites in the Yakima area. And we have in this location, Yakima Medical Dental Clinic, we had a clinic here for decades and recently did a remodel of our space. And one of the biggest things that we addressed was really making sure that our teams had adequate resources in their space, not only for their well-being and job satisfaction, but also the tools they need to do their work every day, making it more efficient and easier for them to work as a collaborative team, which kind of leads into that second bullet there is the work team, making sure we looked at creating spaces where we have care teams that are easily accessible to each other, making sure that people are able to communicate face-to-face a lot easier, which can eliminate barriers to patient care because we have that direct communication and can address issues right away. This includes our ancillary staff like our referral specialists, and so we're not just talking nurses and medical assistants and providers, we're talking about some of our support staff as well. Next slide. So some of the challenges that we've had in our clinics, and I'm sure this is just healthcare in general, not just specific to Yakima Valley Farm Workers Clinic and our clinics here. Provider burnout is always a challenge and something we're working to address. And this can be addressed in a variety of ways, but I think one of those areas specifically is making sure they have the right support and resources to do their job and feel like the burden is lessened, which leads to that second bullet of administrative burden. I think in all areas of healthcare and our work, there's a lot of documentation requirements. Scheduling can be challenging and confusing in some ways. And so making sure that our scheduling is seamless because that plays a big part in provider satisfaction and staff satisfaction, as well as making sure we have adequate scheduling. Coordination of referrals. So this is a big one that we focused on, is having our providers and referral team be able to communicate in the care pods, making sure that They are easily accessible to each other. I know, at least in our area, because we're so rural, we have challenges when it comes to specialty services and referrals. So a lot of times there's back and forth between the specialty offices and the referral specialists, and then the referral specialist has to consult with the provider. And so having that ease of access to each other has been is something that we really focused on, because it was a challenge because of that situation that we're in. We knew that there was gaps and barriers in team communication. The nursing staff, there was a lot of electronic messages going back and forth, and sometimes because of that administrative burden, messages get buried in provider inboxes. And so we wanted to figure out a way to overcome that challenge in that team communication. And then moving away from that siloed operation. So it's not administrative staff in one area of the clinic. Our nursing and MAs are in one area of the clinic, and our providers are in their offices. It's really looking at how do we have this integrated team that is a dynamic team that's working together in all areas of healthcare, that whole person care. We have behavioral health professionals in our care teams. We have, of course, our medical providers, but again, medical assistants, referral specialists, medical record staff. So we wanted to get them all collaborating more efficiently, because they all are playing a role in the care of that patient. Next slide.
Jess, can you hear me now?
Yes, it's a little light still, but we can hear you.
All right, holler at me if I need to speak a little bit louder. I'm not sure what's going on with my audio. Thank you. My name's Andy Nyberg. I'm one of the operations vice presidents at Yakima Valley Farm Workers Clinic, and have been with us for about 20 years. So as Jess mentioned, we really focused on care pod design, how it benefits the patients, the providers, and our staff members. Been doing this for a little over 10 years, since our first redesign of this concept back in our Salem, Oregon clinic, and dealt with two different factors. One, is it a brand new building, which gave us obviously a lot more flexibility, versus is it a remodel that we've done? So really looked at putting in the care pod as many of the pieces that Jess talked about as we can. So care pod team in the center of the clinic, with the exam rooms built around the outside. Looked at embedding our nutritionists, our behavioral health consultants, our primary care providers, nursing staff, referral coordinators, really with that focus of enhanced communication and efficiency, which ultimately spills all the way down through staff satisfaction and patient satisfaction. In some of our remodels, it was how do we get the best we can, and came up with some creative alternatives in some of our clinics where space limited us. Maybe the most well-received is we got really intentional in talking to our staff and designing our buildings around the break and rest areas for our staff. Instead of it being an afterthought of, hey, here's 300 square feet left over, turn that into the break room, it was an active part of the discussion. And in one of our newer clinics in West Valley, it's on 2 floors, and break areas both inside and outside available on both floors for the staff, and the ability for the OBGYN team to step off the floor outside onto a balcony when they've had a difficult discussion or a difficult interaction and just needed a few minutes. And again, just allowing the staff to give us some feedback, but then also to feel at the end of that they were heard and they were valued in the way that we designed our clinics. Looking at things like, are there charging outlets in the break rooms that make it convenient for them? Did we put enough refrigerators and microwaves in the break room so staff wasn't standing in line as they were going through that process? And then in Jessica's clinic at our big Yakima, which was a remodel, we were able to acquire a little bit of land next to the clinic and dedicate space for employee parking and dedicate a walking path. And and really an outdoor and indoor break area, again, just to allow staff to have some rest time. And I'll steal one of Jessica's sentences. The result at the Nob Hill Clinic from a teamwork perspective, it's really just even hard to measure, because now instead of providers eating in their offices, providers are eating lunch in the break room, interacting with the staff and building relationships on a completely different level, which again, just really helps improve everybody's job satisfaction. One of the really just good examples, throwing the design of our new West Valley Family Practice and OB clinic. We had a number of levels of staff and providers involved in brainstorming sessions. And as we were going through the design of the OB department, and just kept challenging the two docs that were on the call to, as you're seeing patients today, what barriers do you say, oh, I wish? And just kept challenging them to throw that on the table. And one of the staff brought up, we really struggle with our patients being able to have ease of access to lactation support in our community. And one of our longest standing OBGYNs jumped up and just got really excited and said, yes, 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 you can throw away everything else I've said, build that. And so we were able to work a design into the clinic that really has an entry into the lobby and an entry out of the care team area for our moms to be able to walk in and see a nurse and get some lactation support at any time. And also for the family practice team to be able to walk that mom and child back into that area. And that was 100% driven by feedback from our staff in the design process. And then a few of our clinics we were designing during and immediately after COVID. So infection conditions were at the forefront of what we were talking about. So really moved to including more negative pressure rooms into the clinics. And then in our newer clinics, aligning a back parking lot accessible to the care team areas to be able to have a well-designed space in the event of needing to bring people in directly into the clinic into a negative pressure room. Next slide, please. So this kind of recaps most of what we've talked about. There were just ongoing nonstop conversations, both during the design, before the design, and even especially in like Jessica's clinic, where it was a really large clinic that remodeled after the fact. What can we try and change? One of our first clinics that we designed in this concept was in Salem, Oregon, and we happened to have the advantage of we were taking over an empty Office Max building. And so the architecture firm that we were working with, as we were designing the care team area, they actually built one in cardboard in the empty building. And our staff from that clinic were able, over a couple hours in an afternoon, able to go in and give feedback about their reactions to just seeing what it would look like since it was different. And then for us, one of the other just really beneficial is we have a VP of facilities who's engaged in all of our clinic designs, and so is able to carry best practices and from each one design to the X, what didn't quite work as expected, how do we tweak it? And he's just a constant in all the discussions and helps us just get more and more refined as we go. Next slide, please. And Jess, you can feel free to jump in anytime you want to add something too. But the results and our outcomes, the providers in the clinics have become highly satisfied as you start to really talk to a team, especially in a remodel environment, about we're moving away from the providers in the back of the clinic in private offices, the nursing staff in the front. All those conversations weren't necessarily easy. and took some buy-in, and we had early adopters and we had late adopters. But as the clinics got opened and the team started really seeing the benefits of being in a care team area, we haven't really had anybody that's insisted on going back. They've all bought into the concepts and started learning the benefits. Communication and cohesion is just so much better with the care teams in the middle. We've been able to avoid chasing in basket messages because now you're sitting right next to the person, and your access to the behavioral health consultant or the RD isn't a message away. They can be right there with you. The support staff builds better relationships with the providers. They're just the ease of communication, the getting to know everybody on a different level has really just continued to build that team and camaraderie concept, and everybody gets a little bit deeper appreciation for the jobs that they're doing. We've talked a lot about referrals already, and in the patient feedback, especially in the remodeled clinics, it has been incredibly, and you see a direct quote there that was actually said multiple times in the Yakima clinic is patients were still coming to the clinic during the time. One of them just looked at our medical director and said, "I feel like you're building this clinic for me. I've been coming here for years." And so it's just been really satisfying across the board. Next slide, please. A little bit of numbers, measuring the before and after, especially in the Yakima area with the two sites we did there. Overall satisfaction from patient scores rose from 90.8 to 91.8. Cleanliness and appearance, that makes sense, especially in a clinic, as the Yakima clinic had been around for a long time before the remodel. So that score really jumped impressively. And then the provider weight, and we really think the provider weight score picked up because of the efficiency advantages within the team. That, again, just back to that ease of communication and how much faster things happened, and patients noticed that. And then clinic employee satisfaction, when you look at how the Nob Hill Yakima team specifically post remodels is doing compared to the overall farm workers average. And that clinic was typically one that lagged behind the farm workers average, and has really just seen some nice growth.
And I want to speak to that. Supervisor communicates effectively with our team, because I think that ease of communication a lot of times comes from the way those pods were built, and the supervisor has very easy access to the team, and the team has easy access to their supervisor. And they're able to do huddles a lot easier with the providers. They're able to communicate on just day-to-day things that come up, staffing, coverage, where's the float MAs, where are they going to be? So that supervisor communication is a big one that improved. And I don't think necessarily we thought of that as being one of the goals when the remodel was being done. I think it was a lot about like the care team and the provider communicating with the care team and the support staff, but it's really also has a big benefit on that supervisor employee communication as well.
Yes. Next slide, please. Just a little snapshot of the waiting area transformation at the Yakima clinic. And again, this was one of our older clinics, but as we redesigned what that front entrance would look like, it was heavily driven by feedback from the front office and reception staff, and created an environment with some light. The directional finding for patients, the red kind of indicates throughout the clinic, a patient landing spot, stand up, approachable reception desks, and light. And so again, largely driven by what the receptionists were recommending throughout the process. Next slide, please. You can see the difference of the care team from what the above pictures, the Yakima Clinic to the new care team model. And again, this was a remodeled clinic, so we were limited in what we were able to do. We were trying not to blow out walls and to do as much changes as we could within the existing concept. So that care team in the teal or aqua color behind that wall is where the providers and nurses and behavioral health consultants and everybody is located during the day, and you know, with the fresher paint, fresher floors. And then in this situation, because we were a little limited in space, there's 4 different pods in that Yakima clinic, and each pod has one offline workspace that the 5 providers in each pod can get off the care team right across the hall and into a shared workspace. So if they wanted to eat their lunch at the counter, or they needed a more private phone call, there is an area that we have dedicated for that to be able to happen.
And I think
Next
you
slide.
can see in the old clinic, you could not visually see where your team was. And I feel like now that is a huge benefit of the care pod we have now, is everyone can just look around and see who's available, who's around, who can I ask a question to, who can I have come help support me. So before it was just hallways and the space where the MAs were located, you visually could not see who was in there.
One other thing we had to overcome as we were building these first, and with each team, is this idea that, hey, we're going to be in the middle of the exam rooms and we're not going to be able to get anything done. Patients are going to keep just interrupting us and distracting us. And it really just hasn't happened. You can see in this clinic, we put the little, you know, see-through plexi dividers there to kind of create a separation, but we're still having the MAs walk the patients out of the clinic. So that was just a fear that really hasn't materialized as we've moved forward with this design. Next slide, please. Lesson learned, there were a lot. You know, we did our first one, I think it was 2014 in Salem, and have done a handful since. We've had to look for ways to help with noise level. And so you saw in that Yakima picture, there were some drop down noise barrier tile designs coming, so you can build it into the clinic to look like it was intentional design, but it's also adding noise protection. You know, really have landed on, you know, more than 18 is just too much for that care team area. Our first one in Salem had 26 members, and it really did take away, it added distractions and a little bit noise. And as we've gotten more and more refined, 18 or a handful less seems to be really the ideal size in a care team. Mentioned a little earlier, but just the small things like making sure the Nob Hill team had 3 microwaves and 3 fridges and a couple different water dispensers, the little things that the staff have just continued to call out as just nice things that people acknowledged they have. And then just the nonstop communication with the staff of, hey, we tried to do our best, but what's not working? And what can we tweak? And making, obviously we're not remodeling the clinic, but little tweaks, what can we do to help improve what we did? Next slide, please. I think we talked a lot about communication, and really it's from the initial design, getting feedback from everybody. In the remodeled clinics, I think Nob Hill, the facilities team we have and the communications team we have did a great job of communicating both to staff and patients before, during the remodel. The patient, you know, we were closing 25% of the building at a time and remodeling while we were still seeing patients. And that was really hard, but we really had good directional signing, but also some pictures of what's coming. And the patients really enjoyed being able to see what's coming while they were in the midst of construction and organized chaos at some point. And then engaging staff we've talked about, and then being able to adjust the design, but based on whether it's a new clinic or a remodel clinic. And then we're in so many different communities. What's the different size of the clinic or needs of that personality individual to that unique location? And then future is just continuing to look at how we can use our physical space to continue to just get retention and buy-in of our teams, and then continuing to look at how technology continues to make our jobs more efficient. And I think the way Christy says it is, let humans do what humans need to do and let the technology do what it can do. And then the Nob Hill Clinic, that remodel and expansions of space has really allowed us to do a couple really interesting pilots. The Yakima area, we have a number of clinics and access is challenging. And so instead of building our own same-day care, immediate care, we were able to pilot that. We're 6 months into that pilot and it's looking really, really well. And in addition, looking at how do we drop an ortho APC into our primary care clinic. The Yakima Clinic's about 18 medical providers. And so we're 4 months into that, and it's just been phenomenal, and targeting, again, better access for our patients and ultimately ER utilization reductions.
Andy, one thing I want to tie into that, since we're talking about, provider well-being, the unexpected benefit of that same day ortho pilot, I think our approach of being very intentional in how we involve our staff and providers in things that are impacting their work has allowed them to think more creatively. We weren't asking as much before, but now we're being really intentional about making sure that they're involved. And so we're just getting ideas now that we never got before. And it's because of that intentionality and involving in people.
Yes. Not sure if there was another slide or not. Oh, there we go.
Sorry, I was also trying to turn on my video. So I think Zoom today is just being a little bit finicky. So I just wanted to open it up to the audience. Does anybody have any questions to the wonderful speakers we have here today? I did get one question that was sent directly to me around how you plan the financing or able to get financing to make these structural changes.
Couple different methods. We typically will get bond financing in Washington State. There's a Washington State Healthcare Facilities Board, and so you get tax-free exempt bond financing. So we've done that. We've also done new market tax credits as well in a couple of our projects. Those are much more involved, but they are doable.
Wonderful, thank you. And for everybody in the audience, please put any questions you may have in the chat and I'll be able to read them out loud and ask those questions. I did want to ask, because one of the things we talk a lot about when looking at well-being, or really anything with the workforce, that I really love that you all did, was starting with talking to the staff first. And we really advocate for, or we really make sure that people understand that, because you can make a lot of improvements, but if it's not really working with what the staff needs, then there's a really large investment that happens that may not really pay out in the way that you're looking at. Could you tell me a little bit more of that process on how you got your staff involved with this? Because I feel like we get this question a lot in a lot of the different trainings that we do. So it'd be great if you could give some insight into that.
Yeah, I think a few different ways. I think intentional is the word I would use. So really being intentional about getting the feedback. I think from a concept of promoting supervisors and hiring leaders intentionally who are on the ground communicators and nonstop communication. I think as it's formally putting a team together, it's being intentional about the thought of who should be, what departments should be represented, and then selecting people who are known to have good feedback. I think something that we've done for the last few years that Christy has driven is an active employee engagement survey that's asking our employees to rate us on how good are we from a senior leadership perspective at communicating with the staff? How good are we at involving every employee in the decisions that affect their work, down to how good is your immediate supervisor at communicating with you and providing feedback? So a lot of different ways. And then this last year, as we were developing our strategic priorities, and we really turned it over to the local sites to say, we need your feedback on specific tactics on how to achieve some of these strategic priorities. And that was fantastic. And Jessica's team, for example, they didn't just sit down with receptionists. They created a bunch of different groups that had multidisciplinary staff in it, just did whiteboard exercises based on whatever that strategic priority. And one of those ideas for the same day clinic came out of several of our clinics saying, we need some sort of immediate care expansion. And so again, I think intentional is the word I would use.
Well, and I would add one more thing to that: intentional with appropriate boundaries. Because the worst thing to do is ask for feedback and then you can't implement it because you couldn't afford it, or there's other barriers. So I think that's the other thing that we've done. When Andy was talking about the tactics, we were very specific on what we were asking about. And so that gives you a higher opportunity for success, because you're more than likely going to be able to execute those things.
Yeah, thank you for that. Because we mentioned the exact same thing. We do a lot of trainings on staff satisfaction surveys. We're like, if you're going to talk to staff, whether formally or informally, please make sure to follow up, because we know there's that survey fatigue and people feel like, well, if I'm giving this feedback and nothing is coming from it, then what's the point of doing that? So it is wonderful to hear that. And I like the intentionality behind it with those appropriate barriers, because to your point, Christy, as well, if, you put out a lot of things, but it comes back of like, yeah, we can't do any of this, then, you get the same effect. And, all of that, I think, plays into each other with the well-being of your staff. So I am actually not seeing any other questions in the chat right now. I'm thinking, so we have about 15 minutes left, and I'm sure nobody ever complains to get a little bit extra time back.
Michelle, I'm going to add one more thing.
Yes, please.
Obviously, you can't always remodel all your clinics, right? So I think, Andy had, I think, shared in another talking session about things that you can do beyond just a remodel. And one of those things, I was surprised when I went to the Yakima clinic that was recently remodeled. I was shocked at how popular the extra refrigerators were. That's all they talked to me about. It's like, I love having extra refrigerators. So it's like, even if you can't remodel your clinic, if you can find some space for just things like that, I'm always shocked at how impactful that can be for staff.
Yeah. We got an ice machine. That was like, I didn't hear the end of it. They were so happy to have an ice machine.
I love all that stuff, because I agree with you. I feel like those are the things, like just having, a break room and a space to do that, and enough place to put your food. Yeah, I would love an ice machine. Like those are always great things. But I think it also goes to your point, and something that we talk a lot about in the STAR Center is that it's not necessarily the ice machine or the refrigerators, but it's showing that you care for your staff and you're listening to them, and you want to provide them with what they need and what they're telling you need. And I think, as you all did the presentation, that's something that really was just so beautiful with what you were talking about, that it just shows how much you care for the people who work for you. And we all know, people they leave bad managers, they leave, when it's really that organizational norms or environments that may be a little bit off. And in healthcare and community health centers, with how difficult this work is, I think just seeing you know, the changes that you all have made just really showcases how much yeah, just care you're showing for your staff. And then I see Katja Road on there. So she says, thank you for your thoughtful answers to these questions. And then also an ice machine could help with the East Coast heat wave. So yeah, I live in Florida, and it's actually colder in Florida than it is up on the Northeast area. So
And I'm going to pick on Andy and Jessica one more other time.
Yeah.
You know, not all of our current facilities have these nice care pod setups. And so could both of you share some tweaks that you've done in other facilities where we haven't had the luxury to be able to remodel of how to still try to get some of that cohesive care team model?
I think a few, and then I'll let Jess do it because she's more deep in the weeds. I think challenging the teams and clinics that aren't getting remodels to think about what being together improves and how can you get there. So moving more and more to laptops as opposed to desktops. So, you know, somebody can pick their laptop up from their desk and go work off a corner. Looking at things like drop down shelves. So a nutritionist could just, you know, it's mounted to the wall, the tray drops down, he or she can put their laptop on it, gets them closer to that area where the providers are at. And then even in a couple clinics, starting the change management of taking those more private provider offices, getting some of the big bulky furniture out, building a built-in counter around the edge, and integrating care team members into the offices with the providers has been really beneficial.
Wonderful. Thank you so much. Yeah, I think sometimes, you know, the way that we structure offices, people don't always realize how much that the flow and the design is so critical. And like you all said, how people communicate with each other, the better they can communicate, more trust is built. So again, I just really like how intentional you all have been in really thinking through that physical space. So it, you know, when I was talking about those 4 pillars, that physical one tends to be the first one, because that I do think that one also tends to get overlooked. And it's just like, if we spend most of our lives at work, you know, how do we make it a welcoming place that we want to be there? And then let me just see. Oh, yes. And then Katja Road, amazing and inspiring. And I completely agree. So I just want to wrap up with a few closing slides. But before I do that, Christy, Andy, Jessica, is there any last things you would like to add?
You know, I think the lessons that I've learned over the last few years is, you know, trust the people that are closest to the work, you know, give them the opportunity, the platform to get their creative juices going. And that's really been paying off for us the last couple of years.
That's wonderful.
Yeah, I would just echo that. And, you know, so many years of trying to solve the problems at a corporate level, and you talk about how do we improve the reception check-in process. Go ask the receptionists. They probably know what they're struggling with every day, and they've been largely beneficial as we've moved to an e-check-in and tablet check-in process of telling us this is how you could improve that. And so again, I think it's just that intentional. Just talk to people. They know what they're struggling with.
And I also would add too, is I think when we talk about communication, like in-person communication, I think sometimes that gets lost. We're so focused on our emails, our in baskets, our electronic messages. And I think just fostering that culture of talking to people in person. And if you have a question, instead of sending a message that might sit in a provider basket for like a couple of days, what's really best for the patient and what's best for everyone on that care team is for you to just go and ask the question of the provider that's, you know, 10 feet away from you, and encouraging staff who maybe before weren't as comfortable with that direct communication. How do we support those staff and help them grow in their communication skills and foster a environment where everyone feels comfortable having those conversations?
Absolutely. And again, I feel like you all being a health center really reiterates so much of what we talk about, where it's like, ask your people. They will know what their struggles are and what their needs are. And then I think as leadership and as an organization as well, it really helps even with the investment and the time, because you know you're creating something that is going to be welcome and is going to be used. So I just want to say thank you so much. You all were absolutely wonderful. You're an amazing health center. Thank you, Christy, Andy, and Jessica. This was excellent. I do want to let you know there was another comment in the chat from Patricia, said thank you for sharing. This seemed like a really successful intervention, and then they appreciate that you have shared so many details. So thank you so much. This really was absolutely wonderful. As I mentioned to everyone, let me just go through these. In a moment, Mariah is going to have the evaluation pop up. If you could please just fill that out. It's just going to take a few seconds. I believe it's just 2 to 3 or 3 questions. Again, we would really, really greatly appreciate that. And then tomorrow at the same time, with the same link. So if you registered for this webinar series, you have already registered for the one tomorrow. We will be talking to Seymour Health Center, who's also going to be presenting what are things that they've implemented in their organization to support that well-being aspect of their staff. And thank you everyone for being here today. And again, thank you, Yakima Valley. You all are amazing. And this was great. And then for everyone, think about the evaluation as your ticket out. So once you're done, feel free to head out, and we can give you back a few minutes to your day.
And thank you, Michelle, for giving
Yeah.
us this opportunity.
Absolutely. Thank you
Thank you.
so much, everyone.
Thank you.